What's going on, everybody? It's John Stamper from ADOM TV, and I'm so glad for all of you that waited for this ADOM livecast because you are in store today for an amazing presentation from Rebecca Bolden, who is from Lighthouse 360. Rebecca, how are you doing today?
I'm doing great. It's nice and sunny here in Texas, and I'm glad to be speaking with all of you guys on Facebook.
Awesome. Well, I know the ADOM Nation out there truly appreciates these live casts, and I know they're going to love what you're going to share with them today, especially as we've been moving towards this practices are getting back to, into the practice with their patients. And the most important thing is, Rebecca, well, there's a lot of important things, but one of the big things has been the schedule, making sure that it's full. And I know that you have a whole host of great things to show that Lighthouse 360 does in regards to their software and things like that. So I'm going to go ahead and turn it over to you. I know you've got a great presentation. And then what we'll do, everybody, we'll do what we've always done is please, put your questions in the comment section. I'll be sure to go through all of those. And then when Rebecca is done with her presentation, we'll come back on and we'll do a little Q&A with Rebecca. So Rebecca, the floor is yours.
Sounds great. Thanks for the lovely introduction, John. I want to say good morning or good afternoon to all of you out there. And I know your time is valuable, so I am going to move quickly as I go through and show you what Lighthouse is really, why you would use this in your practice and essentially how we can do it. And when you think about Lighthouse, I want you to really think about us as being, the most automated, most comprehensive communication system in dentistry. And the key word here with Lighthouse is all about automation. We help with facilitating that communication between office and patient to save time and to increase patient satisfaction and overall increase production for practices. So, Lighthouse does a lot of different things for our clients. What I'm going to cover today is really just a high-level overview of all of Lighthouse's features, and then I'll dig into the more popular features that your practice can use today to communicate with patients during this current crisis, and features that are really going to get you back to speed, as soon as you start seeing patients regularly in the office again. So the first thing I want to go through with you is our paperless forms. And we understand the importance of not only a first impression for any new patients who are coming in, but also making sure that we're getting the correct information from all of your existing patients. And so one of our most popular features, Patient Fast Track, it really helps streamline the new patient experience. We're going to automatically identify new patients in your practice management software because we've never seen them before. And then when we see a new patient appointment on your schedule, we'll automatically send out a text that walks them through filling out those new patient forms. Now, once a patient's completed their forms, you'll get the information sent back to you in just a easy to upload PDF. And for offices who are using like Dentrix version 16.3 or newer, this information, it does automatically write back into the patient's profile. Now, we can even add in the COVID screening questions into this Patient Fast Track. And so that way, we can get all those questions from the ADA answered for your office. Patients don't have to print out a paper, or you don't have to go through that survey over the phone. So this feature, it was originally created just to go out to new patients, but now we can send this out to all of your tenured patients as well. That way they aren't touching clipboards or pens, makes things easier for patients, and it's much easier for the office staff. Now, the way that Lighthouse works, really our sync technology, is called True Time Data. And we start by putting a small program on your practice management server. That little program, it just has one simple task, and that's to synchronize the data between your appointment book and your Lighthouse account. And it's a secure connection. By the way, we're HIPAA compliant. You'll have a business associate agreement with us. But this feature, it allows us to securely sync with your practice management system every 10 minutes. So you can be rest assured that when Lighthouse communicates with patients, the information, it's always up to date and accurate, even as right now you're making all those little changes to the schedule throughout the day. Now, one very useful tool we provide the front desk staff is our daily task list. And so every morning we're going to send you this report, and it looks at the patients you have on your schedule for that day. It checks off all the criteria listed on the right-hand side. And then on the left, you'll see an example of this daily task list itself. And as you can see, it just makes it very easy and very simple for the front office to know what, if any, information they need to get updated from your patients. As they're checking patients in for their appointment, it's kind of like that little cheat sheet, that little checklist. And we even make sure that the information you have currently on file for patients is accurate and up to date. So like here in the example with Holly, it says to verify your email. That's because there's an email for Holly in your practice management software, but we've never got a response back from her. So it just prompts your front desk when they're checking Holly in, ask her about her email. Right now, it's so important to make sure that you do have as much contact information on file for your patients. The second option here, with Edward, it shows we're missing a cell phone number. So with Lighthouse, we can differentiate between a cell phone and a landline, no matter what field the phone number's in. So even if there's a cell phone in the home phone field, we'll still recognize, hey, that's actually a cell phone. Make sure that patient still gets their texts. And then the final thing I want to show you is what we can do as far as tracking family information. So like at 2:30, Daniel's coming in for an appointment, but we can see his son Justin's due for a cleaning. So this will remind the front desk to go ahead and get Justin scheduled for his next cleaning while Dad's still in the office. And a lot of offices, they'll use this daily task list in the morning huddle, or some even use it as their own morning huddle agenda. So not only do we have the ability to send out email and texts for patients to confirm appointments, but we can also remind them to do something before they come into the practice. So a couple examples of this here, like on the left-hand side, you'll see this pre-med reminder. We call this feature special messaging, and it's perfect for patients who would be pre-med, or patients who require, fasting instructions prior to sedation. If we can automatically include those messages in the reminders, that way you don't have to give them an extra phone call just to give them special instructions, and you don't have to do anything different than what you've already been doing. And that's probably the best part. Since we can read appointment codes and medical alerts directly from your scheduling software, when this is applicable, we'll just automatically include it. Now, we can also do other things. As you'll see there on the right, this office wants a new message to go out to new patients only. And new patients, they want to arrive in the office, 15 minutes before they come in. You'll see on the right-hand side an example of family appointments. So if you do have a family or an individual has multiple appointments in the same day, we can combine those into one email or one text. They only have to confirm once, and then it confirms all those appointments in your management software. And we want to make things as simple and as convenient, not only for your patients, but also for your office, so that your time slots are consistently full. And it doesn't require any extra work on your end. With our system, we can automatically identify family members by their profile information. You don't even have to create a family file for this to work. It just makes it much more convenient for you. And so the other thing that offices are doing right now is they are including additional instructions in here. This office here wants to please contact our office prior to your appointment if you have tested positive for COVID-19, or if you're experiencing any of the following symptoms in the past 2 weeks: a fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell. So the nice thing with Lighthouse is that we can customize these messages. That way you're conveying over exactly what you want to convey to the patient. And the look and the feel of these messages, all of the branding, it's created for your office. So we'll work with you to create a unique layout that'll include your own colors, your own logos. Something else to keep in mind is our messaging is bilingual. So if any of you there have Spanish-speaking patients, we're going to show you how to indicate that in your practice management software. And so when we send them messages, they'll be the proper messages. Now, the same email template we create for you with your colors, your logo, we give you access to that through the Lighthouse portal. And we call this our eBlast feature. And so it's easier than ever to reach out to your patient base, letting them know about changes that you've made in your practice. We want patients to feel comfortable when they're coming in. And some of the messages you can send out are for things like reopening date announcements, staff updates and hours, and new infection control measures, such as new PPE or new standard operating procedures that they're just going to help put the patient's mind at ease. And some offices are using this tool to let patients know about technology you're introducing. You can also use this to send out benefit reminders, custom newsletters, update patients on new products or services there in their office. You know, some offices, they're coming into this new normal and they're letting patients know about in-office dental plans. So patients who lost their dental coverage, they're not going to have to forego care. They're still going to be able to come on in. And so super simple through this eBlast tool. You can use one of our templates or you can create your own message. And then you select who you want to send this out to, whether you send this out to some of your patients or all of your patients anytime you want. And again, everything's branded to your practice, your colors, your logo. And it's nice because this is accessible from home. So with Lighthouse, you can log into Lighthouse anywhere that you have access to the internet. You know, you can communicate with patients without ever having to step foot in the office. So you can log in from your home computer or your cell phone and communicate with your patients should you need to. Now, this was really useful when letting patients know as soon as possible about office closures, and it continues to be a feature that offices love when they're faced with an emergency, such as inclement weather, because with a few clicks, you can just let your patients know that your appointments for that day have been rescheduled or canceled. And Lighthouse, remember, we sync up with your practice management software every 10 minutes. So this is always going to be the most recent version of the schedule. Now, additionally, from Lighthouse, you can see who's scheduled for the day, who's coming in or confirmed. If you need to have one-off communication with your patient, you can send them a text message, and you can do all of this from the Lighthouse portal, which again is available from any computer or mobile device. Now, the next thing I want to talk about is reviews. And dentistry's kind of always been a word of mouth industry. And, you know, a lot of practices feel like it'll always be a word of mouth industry. But word of mouth has changed so much over the last 5 to 10 years, where even if my neighbor refers me over to your practice, first thing I'm going to do, I'm going to go online. I'm going to figure out where you're located and your phone number. And it's nice to see some positive things being said about your practice. So for a lot of practices, generating online reviews, it is an important part of building their patient base. And the way that this works is we can identify when a patient's appointment's been completed. And instead of hoping that they just go out of their way to leave a review, we immediately send them either a follow-up email or a text to secure their feedback. Now, we wouldn't go out after every appointment. We send this out once or twice per year. And when a patient selects leave us a review, Lighthouse will send them directly to one of the review sites that you have specifically told us you want that patient going to. So here's some of the more popular sites, but if you want reviews on anywhere else, just let us know. We'll put it into rotation. And for a lot of practices, their main priority is just Google. Now, Google, they don't allow any third-party reviews to get posted to your Google business listing. And the second rule with Google is that they do require that a patient has a Google account in order to leave a review. So we came up with a solution that just sets us apart from other companies. And what that is that anytime a patient clicks this leave us a review, if they have a Google account, we can just automatically direct them to your Google review page rather than any of the other review sites. And we can recognize that because they have a Gmail email address. And we've seen a lot of success generating these native Google reviews by doing this. So we also have our own review site if you want. It's called Rate-A-Viz. And this site just allows us to push positive reviews to your websites and your Facebook newsfeed. So the next feature I want to walk you through is something that is really a favorite of most offices, because as you guys start seeing hygiene patients again, the last thing you want is an empty chair because of a last minute cancellation. And so we have a tool for filling in last minute openings on your hygiene calendar. It's called Fill-In. It's genius. With Fill-In messaging, when we see that there's a cancellation in your management software, Lighthouse will send you a notification asking if you want to fill in that appointment. You don't have to figure out who to call through lists. You just click one button, send text. And when you click that, Lighthouse will automatically send out a blast text message to patients who are most likely to accept that appointment. So, who do we send this out to? You say, oh, well, this is the great part. So we're looking in your practice management software. We're looking at patients who are on your quick fill list. We're also looking at patients who are past due for recall and they don't have a future recall appointment scheduled. From there, we narrow down the list based off of that patient's previous appointment history, just like you would do it. The text that goes out, it lists the date and the time of the opening. The patient can accept the appointment right through the text message. So it just makes it easier than ever when you do have to fill in a last minute hole in your calendar. We want to make sure that we can get that chair full so that's not lost production for the practice. Now, there's a more hands-on approach to this as well. If you wanted to send out a mass email or a mass text message to just your sooner possible patients, you can do so, just letting them know, hey, there's an earlier appointment available, give us a call, and we'll get that appointment booked. So those essentially are all of the main messages and types of things we send out. I want to walk you through our confirmation strategy because I'm excited to show you about our virtual waiting room. The strategy, the timeline I'm going to go through with you right now, it's something that can be customized to your office. We know that as office managers, you know your practice and your patients best. And so if you want to go ahead and change up the timeline, not a problem. We'll work with you on that. But the timeline here has worked pretty well for our clients. And what we do is there's essentially two different types of messages we need to think about. The first timeline here is a confirmation schedule. So let's walk through a typical appointment. First thing we do, we're waiting for an appointment to be set in your appointment book. So if you know how to set an appointment in your appointment book, you really do know about 95% of what you need to run Lighthouse. So you set that appointment, we see that new appointment, and then we send an initial email or a text off to that patient. It says, here's your appointment information, has the details. They can click on a link, allows them to save it to their account, or whether they're carrying their calendar on an iPhone or a Droid, Outlook, they print it, put it on their refrigerator. We get something in their hands at this beginning of the process. It's kind of like that electronic appointment card. Anything that is scheduled more than 30 days out, hygiene, perio maintenance, implant evaluations, for example, we're going to send a reminder to them 2 weeks before that appointment. This is key. It is just a reminder. We don't want them to confirm that far out. We just want to make sure it's still on their calendar, especially if they booked this months ago. A lot has changed since then. After that, we leave them alone until we get to 4 days out from their appointment. We use an approach that's called an escalated confirmation process, where we just use one form of communication at a time because we want to avoid overwhelming our patients. So we start with the least intrusive, which is an email. So we send them an email that says, here's your appointment information. And again, like we were talking about earlier, you can customize these messages. So you can let them know to contact you if they've been experiencing any COVID symptoms. You can let them know about pre-med instructions in here. It's just great. But we send over the email, right? If they confirm, fantastic. We mark them confirmed in your practice management software, and then we stop sending confirmations. If they don't confirm, we wait 24 hours and we do something different. And that's when we send out a text to them. As you'll see here, the message, it's very clear, very easy to understand. Even if that patient, they text back something other than C and they text back okay or K or yes, we're still going to identify it as a confirmation. We'll still mark it confirmed in your practice management software. Now, let's say the patient didn't confirm from the email or the text. Next thing we can do is an automated phone call. Just like email and text messages, all automated phone calls, they're unlimited and they're included. And it's pretty cool. If the phone call goes out, the 2-day mark, has a couple things going for it. One, if the patient doesn't pick up, we're simply going to leave a message. And two, if they do pick up, we're going to give them the option to press 1 to confirm. If they press 1, again, we're going to mark that appointment confirmed in your calendar and your practice management software. And then if we make these calls for you guys during office hours, they can press 2 to be connected back to your office. You prefer do the phone calls yourselves? No problem, but this saves offices a lot of time. Now, after that, as long as they've confirmed, the only other message we're going to send out to your patients is one last-minute text reminder. And you can set this up when you want it to go out. Most offices have this go out about an hour and a half before the patient's appointment. Kind of acts like an alarm clock. You've seen it prevent a lot of no-shows and last-minute cancellations. And if they are running late or the patient has a question, it's full 2-way texting through the Lighthouse dashboard. And so this really is where this virtual waiting room is going to come in. So we can include, remember those COVID-19 screener, we can include that in any of the messages that we send out to your patients. Some offices even want us to send out that COVID screener here in the last minute text reminder, which we definitely can. But there's this 2-way texting templates that are set up for the office for this virtual waiting room. Right now we're just experiencing a different time where you don't want people waiting in physically waiting in your waiting room. And so the way that this works is when a patient is coming in for that day, you can go into Lighthouse, you can send them the virtual waiting room, pre-arrival message. There's things already set up in here for you, but if you want to have your own message, you can go in here, you can create your own, make it say exactly what you want. You'll see this example here. It just says, when you arrive at our office, please wait in your car. For the safety of you and others, we're limiting patients in the waiting area. Please let us know when you've arrived by responding to this text, and we'll respond when your chair is ready. Makes it so much easier to control that flow in and out of the office. Patient texts back, they're here, and then you can go in and just send them the virtual waiting room post-arrival message. Hey, thanks for waiting. And then if you want, hey, we're ready to see you, come on in. Or some offices are, hey, thanks for waiting. We'll let you know when we're ready to see you. Hey, thanks for waiting. We're coming out, we're taking your temperature. Whatever's going on in your office, you can make sure you convey this to your patients just in a really easy way. And this virtual waiting room for the offices who've been up and running, they absolutely love this. It saves them a lot of time. Now, as far as patients who, they were scheduled and then COVID-19 happened and then you guys stopped seeing hygiene patients. And I want to talk for a moment just about recall, because we have a variety of ways we can reach out to your patients. And one of the best parts of the Lighthouse program is our recall strategy, because right now a lot of your patients, they're missing their appointments. They're going to be behind on recall. And we all know the struggle it is just to get patients to come back in for a recall appointment regularly. But with Lighthouse, it isn't going to be an issue. We're going to make sure your chairs stay full, because for those patients that did miss because of COVID, they're going to get picked up into our recall timeline. We're going to be able to communicate with them, as well as anybody else who might be past due for recall, to get them back in and help keep your schedules full when you start seeing your patients again, regularly. Like hygiene schedules are kind of fluctuating right now, but we want you guys to have a strong schedule. And the great thing about Lighthouse, as far as our recall process goes, is we work recall for you every single day. Every single day, we look in your patient management software and we look for patients who are a month away from their due date but aren't scheduled. We can see continuing care notes in your practice management software. We can use that to determine their due date. We can also tell the difference between appointment types. So we know to base that due date specifically off their last hygiene or perio visit. It just makes sure they stay on their individual schedules. Now, 4 weeks before they're due, we're going to send them an email saying, hey, you need to schedule your appointment. If they don't schedule anything, we wait a week, try something different. And it shows a postcard here. If you want to change it to a text or an email, you can change it to whatever you would like. Now, for patients who get to their due date and then become past due, and this is going to be a lot of your patients from the last 2 months that you need to get back into that chair for their own oral health. But we continue to reach out to them. We have the same escalated approach. We try one thing at a time. They don't respond, we try something else. When they get to 6 weeks past due, that's where we let you know that you need to make a phone call. We recommend, if you haven't reached them through, emails and text messages, sometimes hearing your voice, it's what's going to make the difference and get them back in. But with Lighthouse being proactive with unscheduled recall, many of your patients are going to reach out to you to schedule appointments before you ever have to make this phone call, before they get to this point. But let's say they still haven't scheduled. We're going to keep reaching out to them. We'll try again at 3 months, 6 months. We can reach out to them for up to a year or longer. We just know how big of an impact recall can have on dental practices. And just to give you guys all an understanding of just what Lighthouse can do when it comes to recall, our clients are seeing their recall time reduced by an average of 40.9%. So it means more of your patients in on time, fuller hygiene schedules for the practice as you guys keep opening up that schedule. And then, let's say a patient gets to a year past due. At that point, that's where we consider them eligible for reactivation. But you tell us at what point you think patients should go into this reactivation mode. And what we'll do is we'll look on a daily basis for, let's say you tell us it's 18 months. We'll look every day for any patient who hits 18 months. And you didn't reach them from methods like email and text and phone calls. We recommend that you send out a physical letter to this patient, which we could automate for you on a per patient basis, or you can do whatever type of reactivation campaign you want. But this is kind of like your built-in chart audit. Now, the last thing I want to go over is what we can do for treatment, because when your office is going through this opening up process, and I know some of you guys have already opened up, some of you are preparing to open up next week, and we just want to make sure that not only are your chairs full, but we can help increase your production as well. And one of the biggest ways that we're going to help you do that is right here with our treatment plan reminders, because we know that those are your most profitable types of appointments. So we can send out a series of messages to patients who you presented treatment to and they've yet to accept it, to help get those appointments on the books and get that production back in the door. So these automated reminders, they're a little different from our other messages because they're activated by you on a per patient basis. So you're in full control over which patients receive these treatment reminders. And then just like our other message schedules, the timeline and how we send these out, it's customizable. When you turn this on for the patient, it's going to trigger a series of reminders to schedule treatment. If you guys take something like, let's say, Care Credit here, for instance, if you guys take that there in the office, you want to promote that, we can include a link to learn more about Care Credit and apply directly from these treatment plan reminders. But what I think you'll appreciate the most is that when you turn this on for the patient, yes, we send out those messages, but if it's been 6 weeks and the patient still hasn't scheduled treatment, Lighthouse is going to alert the office who the staff needs to call. It just streamlines this follow-up process and it increases case acceptance. In fact, our practices are reporting that using the Lighthouse treatment plan reminders, we've been able to increase their case acceptance by 16.4% across the board. So those are essentially all the features of Lighthouse. These are our timelines. Again, we'll work with you to customize this, make sure this works best for your practice. And then a couple of things for you. Our offices are reporting fewer broken appointments, that we're able to save them time. And right now, I know time is so precious because there's so many extra things that you're having to do to ensure the safety of your patients. And then practices are reporting an increase in monthly production by almost 30% on average. And so here's my contact information. If you want to learn more as far as details and how this would work with your practice management software, please feel free to reach out to me. But at this point, I'd like to open the floor, hand it over to you, John, and we can go through some questions and answers.
Yeah, well, first of all, it was awesome. It was neat to sit here and watch all those cool features. And we should have some questions coming here just in a sec. Before they come in, I just kind of have a couple questions I want to ask you for you guys. These last couple of months, Rebecca, what has it been like for you guys in regards to customers, reaching out? I mean, as you know, we spoke a lot of this on the ADOM Cares learning series, where a lot of these practices had time to be able to dig into their software tools that they're using in their practice and really learn a lot of the features that they may not know were available to them. So that's what I loved about what you shared today, is there's so many cool things in there that people can use now. But what has it been like for you guys, like the last, couple of months, just connecting with your customers?
Yeah, absolutely. And John, that's great mention of that, in that you're right. There's a lot of offices who've been using a software forever, and they didn't necessarily know how everything works or all the things that they could do with it. Probably one of the funnier things, or just kind of truthful things about what was going on, is when offices originally shut down, it was like emergency mode. Okay, let's notify our patients as quickly as possible about the fact that the office is closing. Some offices were still seeing emergencies, some were not. But what we saw in a lot of offices is the person who knew how to use Lighthouse, or the staff who was used to using on a daily basis, they weren't necessarily the one who was always communicating with us. And so it was a lot of doctors calling in saying, hey, my office uses you, and I know that I can do this. How do I do it? And so we just walked them through step by step how to send out those emails to all of their patients, letting them know, hey, due to COVID-19, your office is closed right now. If there is an emergency, this is how you get in touch with me. Or as offices have been making all those changes in their practice, just letting offices know, hey, we're still here. We're just not seeing hygiene patients right now. We're getting ready for you. And these are all the different things that we've been doing. So it's definitely been busy over here at Lighthouse as offices are changing up their messaging. And that's one of the great things, is that you can customize a lot of this messaging to make sure that you're conveying exactly what you need to the patients.
Yeah, and we actually just had a request, Rebecca. If you would be able to go ahead and put back up the slide that has your information. I think we've got a couple people out there watching. There we go. Perfect. Excellent. Yeah. Again, I think that it's so interesting to me from a lot of people that we spoke with, during these last couple of months. And I think even now, like you mentioned, I think one of the great things that you guys provide is the sense that they can customize their message. Because I'm sure, as you guys are seeing, practices are doing it differently, right? I mean, based on where they are in the country, they're having to operate differently. And then therefore, to be able to use some of those custom features that you guys provide in order to be able to tailor it the way that they need it, super crucial.
Yeah. I mean, getting the COVID-19 screenings done virtually, where the office doesn't have to go through that checklist with the patient over the phone, or have them print something out, or have them touch a piece of paper, spend extra time in the waiting room than they need to. That's been just a godsend for our practices, because it is convenient for the patient, and it's convenient for you and your office staff. You get it all, you get it on file. And so, yeah, things are changing, and technology is one of those things that, offices who maybe weren't as technically savvy, or had kind of steered away from this, are now embracing the technology.
Yeah, absolutely. So we did have a question. Does Lighthouse 360 allow patients to schedule online with Dentrix software?
So we don't allow, with all of our software, we don't allow anybody to schedule online through Lighthouse,
Okay.
but we do provide the practices all with a scheduling, like a request an appointment widget. So you can add that to your website, you can add it to your Facebook page, and if a patient clicks there, they can go ahead and select the preferred day of the week, the preferred time, and then someone in the office will get back in touch with them. We just want you to have full control over your schedule.
Yeah, and and I'm going to mention that. I'm glad that you shared that because I think for a lot of people out there watching, when you speak about a widget on their website, right, and like what exactly does that mean? And I think, as you know, more and more practices are creating their own websites, and they want that flexibility to be able to put that and integrate that on their website. And I'm sure that's what you mean by them having the control to kind of do what they want to do, which is great.
Yeah. Yeah, absolutely. A widget is a piece of that coding so that you can have that little link, request an appointment on your website. And so we'll help you with that.
Yeah, excellent. So what else? I had another question, which is in regards to, and if you may mention this, but what do I do if I have more than one patient who responds to the text for the fill-in appointments?
That's actually a great question. So with the fill-in, we send out that text. We select 10 patients who fit the algorithm, like they're patients who are either on your sooner if possible list or patients who are past due for recall without a future appointment scheduled. From there, we narrow it down based off of the patient's previous appointment history. And we send out that message, saying, hey, John, there's an appointment on this date and time. Do you want to take it? And you respond back with yes. But let's say that Susan also responded back with a yes. As soon as either of you respond back with a yes, you get an auto response. It'll say, thank you, John, or thank you, Susan. We received your appointment request. We're checking to see if the time is still available. Please wait for us to confirm. And then the office gets a notification saying, hey, John wants an appointment and Susan wants that appointment. And maybe the office manager looks and says, John's a good patient and Susan's kind of missed the last couple of patients. Let's give it to John, or vice versa. As soon as that appointment's either accepted or declined, if it's accepted, you get back another text. It says, thanks, John. Your appointment has been confirmed. We'll see you at this time on this date. And then Susan, maybe she's that patient who's been really reluctant to come back into the office. She was due at the end of March for her hygiene, and we don't want to get her too far past due. So now it's kind of like a warm call list. You can reach out to Susan, let her know, hey, that appointment got taken, but we do have an opening next week at 2:00. Do you want to take that appointment? And so you can kind of fill in more than one appointment with that fill-in tool.
Yeah, that's great. All right, so we got another question. It is asking about approving reviews before they are posted to the various sites.
Yep. So there's two methods of two different ways that we can handle reviews, right? We can send a patient directly to one of those review sites, whether it's Google, Yelp, any number of sites that you would like for us to send them to. Or we can also send them to our Ratabiz, the internal site. If we send the patient to Ratabiz, it's strictly a site that will hold those reviews for you. We don't promote that site, but we do allow for any 4 or 5 star reviews to automatically go out to anybody who does allow third-party reviews on their site. So we can send patients to the Ratabiz, and then if they have a 4 or 5 star review, we can send them directly. That review directly will go and be posted on your Facebook, or we can directly post that review onto your website. Mm-hmm. For Google, they don't allow for that gating. So we just have to send them directly to Google. But because I'm sure you all have 1 or 2 patients who maybe you just feel like, I don't want to ask about their feedback. Maybe we're just having a rough day today. And so we'll show you how to indicate that in your practice management software so that if you don't want that patient to get a review, we'll make sure they don't get a review request for that visit.
Yeah, so they've got that flexibility to do that. That's awesome. All right, so we got another question. Any work you guys are doing or anything that's in place, any credit card authorization forms to use for prepayment to help with this new touchless front desk, or really any conversations you guys have had around people are going for this, touchless front desk process?
Yeah, so there's not a lot that we've been talking about as far as from my level. However, I do know that we're always getting the feedback from our existing clients. So if this becomes something that really is a need, we'll definitely work on making sure that we meet the needs of our clients.
Yeah, that's a pretty new one, right? I mean, I know we had on maybe like 3 or 4 weeks ago a couple guests talking about that, and that's just something that has come about pretty quickly with people asking for that. I will say, and you touched on it, Rebecca, that I think what's been so great about so many of you, the technology companies like Lighthouse 360, is that you guys are so close to your users. It's just the nature of what you do. And I think that's what's been so exciting to see, is for you guys to be able to bring about features in many cases that you get directly from the feedback that you get from your customers, and the ability to do that, not super fast, but because it's software, it's things that you guys can implement once you I'm sure figure out that there's a lot of people out there that would value that.
Absolutely. And John, one of the things that you said, and I don't think I ever addressed it, but we are a dental specific company. We only work in dentistry. So we work with 13,000 either dentists or orthodontists or oral surgeons, endodontists, pedodontists, but everyone's dentistry. So we definitely take notice of the things that are changing, especially right now. And we want to improve our program to make it easier for our clients.
Excellent. Well, Rebecca, this has been awesome. Great presentation. And before we go, just any last thoughts as we wrap up here on this ADOM Livecast?
I think it was great for me to have the opportunity to speak with all of you today. And if you have any questions or want to talk about your office, give me a call, shoot me over an email. And we are all working from home right now, so I'm available. I appreciate your time, John.
Yeah, absolutely. And just let everybody know out there, all of these live casts are going to remain on the ADOM Facebook page, for at least a week. So if for whatever reason you missed any part of it, you had to go back and work with the patient, or I know so many of you are connected to your other colleagues that might have been busy and they didn't catch this great live cast with Lighthouse 360, please let them know, and I'm sure the ADOM team as well, that this live video and this software demo with Rebecca will continue to be available for at least the next week on the ADOM Facebook page. So Rebecca, thank you so much for your time. I know you guys have been working diligently to support your practices all over the country during all of this. So I know the ADOM team really appreciate you guys, and I'm sure we'll talk to you soon.
Yeah, absolutely. I hope everyone stays in good health.
All right. Take care.
Thanks. Bye.